I love exercising and being physically active, but not everyone does. Do you? There are so many benefits to being physically active. It can help to prevent over 20 chronic health conditions, things like stroke, heart attack, diabetes, dementia, and some cancers. It can help to reduce your weight, lower your blood pressure and your cholesterol, improve your sleep and your brain health, including your cognitive function. And best of all, it just makes you feel good. The World Health Organization recommend that each week we do 150 minutes of moderate intensity physical activity. That's the kind that makes you huff and puff. They also recommend that we should do exercises to strengthen our muscles on 2 days a week, and that we limit the amount of time that we spend sitting. The reality is that most Australians don't achieve the recommendations, and this applies even more to older people and people who have chronic health conditions for whom it's even harder to exercise. Approximately 45% of Australians meet physical activity recommendations, and that's less than half of us. And for older adults, only 25% are meeting recommended activity levels. But the good news is that doing some physical activity is better than doing none, and starting small and gradually increasing the amount of physical activity that you do over time can be beneficial. And that's where we as physiotherapists come in. Physiotherapists have excellent knowledge of how to safely exercise with people with chronic conditions and how to make people work within their limits and achieve maximum benefits. We also work to personalise exercise programs and incorporate all of these elements that will make a program work for each individual. So one of the key things we do as physios is help our patients to set goals and then formulate a plan together to achieve those goals. There are a lot of helpful resources that we use to help older people and people with chronic conditions become active. There are some really useful guidelines and sites that can be found online. And a great one is the Safe Exercise at Home website that was created by our very own Associate Professor Kathy Sade here at the University of Melbourne as a resource for older people to help them stay active during the COVID lockdowns. You'll learn a lot more about physical activity and exercise and other exciting topics in the Doctor of Physiotherapy program here at the University of Melbourne.